Hello everyone, a very good evening. After a long time I'm doing the video. I'm very sorry for such a long gap. So today we'll go on with the approach to a child with hemoptysis. I've taken this from the source of Child India, July 2024. Okay, I will share the PDF of this folder also. Okay, fine. Let's go on with the definition of hemoptysis. So what is the definition of hemoptysis? It is nothing but your expectoration of blood or blood tinged sputum from your lower respiratory tract. Okay, it's expectoration of blood or it's a blood tinged sputum from the lower respiratory tract. Okay, yes. How do you classify the severity of the hemoptysis? So severity of hemoptysis has been classified according to a study found in the children with cystic fibrosis as mild, moderate and severe. So which is considered as mild? When the hemoptysis, when the blood is amount or the volume of the blood is around less than 5 ml, then it is considered as mild hemoptysis. Moderate is when the volume is between 6 to 240 ml. Severe is when it is more than 240 ml. But in a practical consideration, we can't measure the volume of this blood. So for practical consideration, it is taken as mild is taken as less than a tablespoon. Mild hemoptysis is taken as less than a tablespoon of blood or streak of blood. Moderate is taken when the child has a handful of hemoptysis or a handful of blood. Next is the severe hemoptysis. Severe hemoptysis is considered as a large volume when it leads to a hemodynamic instability or a airway compromise or which requires a transfusion. So severe hemoptysis is considered, that is when it is causing hemodynamic instability, airway compromise or which requires transfusion. So this is considered as mild, moderate and severe hemoptysis. Next, we'll go into the pathophysiology of your hemoptysis. So we know this lungs usually have a dual supply of blood. So it has a dual vascularity. Yes, one is from your pulmonary artery, another one is from your bronchial circulation. So one is your pulmonary circulation, another one is your bronchial circulation, right? So how do you differentiate whether the blood or the hemoptysis which is coming out is due to your pulmonary circulation or your bronchial circulation? For that we have some practical points. So in pulmonary circulation is usually a high volume and with a low pressure. Okay, and this pulmonary circulation is your deoxygenated blood. It contains a deoxygenated blood which is drained back to your left atrium. So it is a deoxygenated blood which is drained into left atrium. So therefore, when there is a bleeding from a pulmonary artery, or when there is a bleeding from a pulmonary circulation source, it tends to be a insidious one. So the bleeding tends to be an insidious one here. Fine. While coming to your bronchial circulation, this bronchial circulation is a small volume one with a high pressure. It contains oxygenated blood. Why it is a high pressure or it is a systemic pressure? Why? Because it originates from your aorta. Since it originates from the aorta, it has a high pressure. Fine. So the bleeding, when the bleeding is due to your bronchial circulation, the bleeding will be acute in nature and it is often massive. Okay, so this is how you differentiate whether it is from your pulmonary circulation or your bronchial circulation. Next, going into the etiology of your hemoptysis. First and foremost etiology will be your infection, right? So among the infection, bacterial, you have bacterial, viral and fungal. So in bacterial you have your lung abscess and TB can cause a hemoptysis, while in viral it can be your flu, H1N1 and tracheobronchitis. Next, coming to fungal, it is your aspergillus or it can be your histoplasmosis. Okay, these are the few important causes in infection. Second cause can be due to the foreign body aspiration. Third can be due to congenital heart disease. So in congenital heart disease, there will be a pulmonary edema secondary to the heart failure. So that can lead to your hemoptysis, or when there is a Eisenmenger syndrome. So pulmonary edema secondary to heart failure, or it can be a Eisenmenger syndrome. Third, it can be occur in your tetralogy of Fallot, or it can be in your absent pulmonary artery cases, or it can occur in your left-sided obstructive lesion cases. Okay, so these are the reasons for the hemoptysis from your cardiac point of view, right? Next, fourth etiology can be due to bronchiectasis. So among this bronchiectasis, the causes of bronchiectasis are, first one is your cystic fibrosis, second one will be your ABPA, third one is your immunodeficiency, and fourth one is your primary ciliary dyskinesia. Okay, I will take about this primary ciliary dyskinesia separately in another video. Fine. Yes. Fifth reason or fifth etiology can be due to your congenital lung malformation. Sixth one can be due to coagulopathy. Coagulopathy like von Willebrand disease or thrombocytopenia, or when they use anticoagulants. So these are the reasons. Seventh, when there is a tracheobronchial mass. Eighth reason can be due to idiopathic pulmonary hemosiderosis. Can be your idiopathic pulmonary hemosiderosis. These are the etiology behind your hemoptysis, main etiology behind your hemoptysis. Yes. How do you approach this child with the hemoptysis? When the child with hemoptysis comes to your OPD, how do you approach? First step is you have to differentiate whether the bleeding is from your lower respiratory tract, or from your upper respiratory tract, or it is from your GAT. Okay. So first is your differentiating point. So you have to differentiating from other sources meaning one from your upper respiratory tract, or whether it is from your GI tract. So in GI tract, when the blood comes from your GI tract, it is called as hemoptysis, right? Yes, it is bleeding from your upper GI tract, or it can be due to a swallowed blood from your lower respiratory tract also. So but how do you differentiate between a hemoptysis and a hematemesis? This can be your Viva question also. Your hematemesis. Your hematemesis will be a dark colored blood which is mixed with food particles, and which is associated with your nausea and vomiting, right? While your hemoptysis will be a blood which is bright red in color, or a bright red frothy sputum, which is coughed out. So this bright red frothy sputum always indicates a pulmonary source. Next, going on to the investigation. First and foremost investigation, you will do a chest x-ray. So chest x-ray is mostly non-contributory. In up to like 30% of the cases, it is non-contributory in up to 30% of cases. Second investigation of choice will be your CT contrast, that is CECT, contrast enhanced CT you have to take. So in this, when you see it is mostly seen as a ground glass opacity when there is a alveolar hemorrhage. Okay, so it is seen as ground glass opacity when there is a alveolar hemorrhage. Right, next investigation will be your CT angiogram. CT angiogram is to define where the bleeding is occurring. Okay, definite point of bleeding. So you have to take a CT angiography. So you have to define whether it the source of your bleeding, so that you take a CT angiogram. In CT angiogram, you can diagnose if whether the child is having a pulmonary sequestration. Second, whether there is a vascular malformation, or whether there is other vascular anomalies. Okay. Right. Next, fourth one will be your bronchoscopy. So why do you do a bronchoscopy in this? So bronchoscopy is mainly a flexible bronchoscopy you will be doing here to look for the structural anomalies, or when there is a mucosal inflammation, abrasion, foreign body or granulation tissue. If anything is there, you have to look out for that. So you will be doing a flexible bronchoscopy. Fifth one, you have to do a cardiac evaluation. So in cardiac evaluation, you will be doing a echo screening for this child. Right. So these are the main investigation of choice. Right, going on to your blood investigation. We'll write the management next. So going on to the blood investigation, you will be doing primary investigations will be your CBC, blood grouping typing. Third will be your coagulation studies. Right. Next, fourth one will be your vasculitis workup. So in vasculitis workup, what will you do? You have to do CRP, ESR, complement levels and autoantibody levels. Right. Other investigations. So from these investigations, suppose if you are not getting any idea, so other investigations that you have to do are, first one is your technetium 99 labeled technetium 99 labeled scan you have to do, because it can detect the RBCs even if it is as small as 0.1 ml per minute when it is flowing. Okay, so you have to do a technetium 99 labeled scan. Next is final one will be your lung biopsy. So these are the other modalities of investigations that will be necessary to work out a child with a hemoptysis. Next, going on to the management part. For a child with mild to moderate, bleeding, always it is a conservative management. You should avoid NSAIDs and hypertonic saline and mannitol nebulization. Everything should be avoided. When the child is having a massive bleeding or a severe hemoptysis, first and foremost will be you have to prevent asphyxiation. So you have to secure the airway. You have to prevent the asphyxiation. Second will be your circulation, that is hemodynamic stability. If this child is in shock, you have to do the guidelines as per your PALS. Okay. Third one is you have to arrest the bleeding. You have to find the source of the bleeding and you have to arrest the bleeding. Right. Next, so while preventing asphyxiation, that is you have to secure the airway, that is you have to intubate the child, you have to do adequate suctioning and give an adequate PEEP to the child. In stopping the bleeding, you have general measures also and specific measures. So in general measures, first one will be, you can give tranexamic acid because it can decrease the duration and volume of the bleed. Second, you can give vitamin K supplementation. Third, you can give blood products. Right? These are the general measures to stop the bleeding. Next, in a specific measures, you will be doing your bronchoscopy to look for the specific site of the bleed. So you will do a bronchoscopy. In bronchoscopy, you can do bronchoalveolar lavage. Along with that, you have to give a cold saline and a diluted epinephrine because it can stop or arrest the bleed. So diluted epinephrine is 1 in 10,000. Right? You can do a rigid bronchoscopy for suctioning and dilating the airway and removing the clots and extracting the foreign body and all. Okay. Next one will be your bronchial artery embolization. So bronchial artery embolization is performed if there is a consistent bleeding. Provided the source of bleed is from your bronchial artery, then you do a bronchial artery embolization. So if suppose all the measures have failed, supposing if all the measures are failed, then what you do next? If all the measures have failed, next you do a segmentectomy or a lobectomy, or you go in the child for a ECMO therapy while waiting for your lung transplantation. So these are the main key points regarding what you have to write in your exam for a child with a hemoptysis, because this can be asked in your 5-mark question also. Fine. Yes. Thank you so much for your patience listening. Thank you.